Hi, good afternoon. I love that background music. Thank you so much. Hope you all enjoyed the opportunity to network. Again, thank you so much to the Austin Startup Week for bringing us together virtually to both have this event and then provide us the opportunity to meet new people. It's really great to see the innovation and the opportunity to connect. I think if you're anything like me, the past 6 months have been hard, and having the opportunity to connect with people is really, really meaningful. All right. So, our third panel today, I'm super excited about this. We have a discussion on using data, social media, and analytics to understand how to respond to COVID-19, both the impacts and the challenges. This is a truly, truly fascinating topic. So COVID-19 has exacerbated and greatly accelerated the challenges that government organizations and higher education institutions were already facing. No longer are past data models sufficient in accurately predicting future trends around enrollment or engagement patterns. So in this discussion, we will hear about leveraging new tools to understand perspectives and address the needs, concerns, and better prepare for strategizing in today's new reality. So today's speakers include Chris Armstrong. Chris is the Experience Optimization Lead at Accenture Interactive. Welcome, Chris. Good to see you again.
Yeah, good to see you again.
Yeah, we also have Katie Townsley. Katie is a Strategy Director at Accenture. Welcome, Katie. Thank you for joining. Hopefully we have Katie. There she goes. Oh, we've got Mike Speed.
It's a little baby switch. I'm sitting in Katie's place.
Oh, perfect. Okay, great. Yep. Perfect. And Mike, thank you so much for joining us. Mike is the Social Media Insights Team Lead at Accenture. And last but certainly not least, we have my dear friend and colleague, Melissa Maloney. Melissa is our higher education, nonprofit, and government consulting executive at Accenture. Thank you all for joining us. And we've got a fourth panelist. I am so sorry. We've also got Kevin Ellenwood. Kevin, how could I lead you out? Kevin leads our interactive team for public sector. And thank you all for joining. I'm going to hand this over and get ready for a great conversation. Thank you.
Fantastic. Thank you so much, Meg. I'm really looking forward to this conversation. Like Meg shared, we're going to be talking about data, social, and analytics in the age of COVID. So we've got on here several of our practitioners that have been working on different projects with our clients throughout the country, both in public and private service. And we'll share some stories about how our clients have used data and the things that we've learned to address COVID and the things that have changed since the pandemic. We will certainly be taking your questions, so we look forward to them throughout the chat. Let's just start off with some introductions, if we could. I'd like to have each person share certainly your name and a little bit of what you look after at Accenture. And then just to add a little fun, if you guys would each share maybe a pandemic hobby or something you've done during these stay-at-home that maybe you wouldn't have done otherwise. So I'll just start with a quick introduction. My name is Melissa Maloney. I am here in Austin, Texas. I look after higher education here in Texas and have been with Accenture about 23 years. So I have started to relearn Spanish during the pandemic. I had planned on a trip to Spain this past summer, which of course didn't happen. And so now I've decided that I will, when we do go next summer, hopefully I'll be even stronger in my Spanish. So Spanish and a little bit more Netflix than usual has been my pandemic hobbies. Kevin, can I have you go next? Then Chris, then Mike.
Absolutely. So thanks for having us today. I really appreciate it. Meg, thanks for forgetting me today. Kevin Ellenwood, I'm part of Accenture Interactive, and I lead our public sector work globally for Interactive. And that includes all of our state, local, nonprofit, and education clients. And, you know, during the pandemic, I've actually had the opportunity to start playing guitar again. And what I've learned is when I'm home alone and no one can hear me, I am an amazing guitar player. So I'm going to try to keep it that way, I think. Chris?
Nice to meet you all. Chris Armstrong, also here in Austin, Texas as well. As you can see in this little craft behind me that says ATX. We've got, let's see, a history in Accenture Interactive of coming from a startup. So I helped grow a startup called Clearhead. here in Austin that got acquired in 2017 in Interactive. An OG from Capital Factory, Sam Decker, was on our board and part of that journey. So shout out to him and to this crew that might know him. As far as what I focus on, what ClearEd focused on, and I continue to focus on a lot in Interactive, is data-driven experiences and making them perform in digital. So using a data-driven strategy to guide the way forward and experiment towards success and performance. As far as COVID hobbies, I've also been learning guitar. That's been one of mine, but I've been focused on creating like woodwork stuff. So I've made some shelves that I've hung that are floating shelves around the house in different places to free up space in our kitchen to keep us more sane as there's dishes piling up. So that's been mine, is just using my hands to make something else that's not typing on my keyboard.
Fantastic. Mike.
Great, yeah, happy to be here. So my name is Mike Sneed, and I am a social media insights team lead here at Accenture Interactive. I'm based out of our DC office, and during quarantine, I actually picked up an old hobby of mine, making surfboards. So I actually built a 12-foot stand-up paddleboard from actually a local Austin business called Jarvis Boards. So I had a lot of fun building that, also with my hands in woodworking. Yeah.
Fantastic. Well, thank you all very much for those introductions. Let's start just broadly talking about how governments first got started in this idea of social listening. Kevin, can I ask you to share a definition of that social listening and just talk about the genesis of it as we first saw the pandemic hit?
Sure. So state, local governments, and our hospital systems have all kind of dabbled in using social data pre-COVID, but what we have found is immediately after we started to see cities get locked down, we've seen both hospital systems and our state and local governments really pick up the amount of data that they were looking at coming off of social. We found a couple of things that started to happen very, very quickly. State governments started to look at what is the value of the data, what are people or citizens starting to say, how is that relevant to COVID? Started looking at things like, can we identify hotspots as the disease is starting to spread across cities? And we really saw a lot of this happening in Washington very, very early on. It was an early hotspot. It was also a very early place for the use of social listening in order to find infections that were starting to ramp up in zones that were starting to get a little bit hot. But we also found a couple of things that started to emerge during the same time. We found that sure, you can find people reporting things like I have fevers and other concerns, but what we quickly pivoted to during the early stages of lockdown was not using social listening to find hotspots or looking at social listening to try to find people that were in violation of quarantine rules. What we really found is the true value of social for governments during the actual lockdown was understanding what it is that people were not getting. What information were they not receiving? Where was the information stream lacking? And where was disinformation or misinformation coming into the overall discussion? And then how can governments, state, local, be proactive at changing that conversation? And we started to see some real leaders emerge in the space in how they use that information to change and pivot the actual discourse that was happening in the public space. So we started to see it emerge in a couple of really interesting ways. So the use of PPE, and we can talk a little bit about PPE in hospital systems and how they were using social to understand where they're going to have shortages. But also we started to see it become a big indicator of potential problems as far as information around racial inequities of COVID, racial inequities of testing and care, and even the application of some of the entitlement programs that went around COVID with the payroll protection plan and how that started to impact other communities. But the one thing that we did see really early that I think is really important is our government clients immediately pivoted away from trying to use social data as a listening or monitoring tool to police or drive specific actions, and really used it as a tool to gain insights and value from the conversations that were happening around them, to focus on make the outcomes absolutely better versus trying to find where there were violations or fraud within the system. Because quite frankly, it's not super effective at that. And it starts to become a little bit of a challenging place for governments to sit. So really the whole concept of social listening and data analytics around COVID shifted very quickly from early discussions about hotspots, early discussions about ways to find behavior problems, to how do we get better outcomes? How do we make people's lives better? Ultimately, how do we communicate more effectively?
Excellent. Thank you, Kevin, for that overview. Mike, he mentioned some of the hospital work in the Northeast. Can you share some insights that were gained from some of those systems that you worked with?
Yeah, so with some of the teaching and learning hospitals, ones that had kind of authority to release information at a national level, we partnered with them to kind of look at what conversations were in terms of the topics and trends that were emerging as the virus started its outbreak here in the U.S. and the landscape was rapidly shifting. There was a lot of conflicting kind of news reports in terms of how to prevent transmission or keep yourself safe, or what the right precautions were. And so in this, there were some subsets of potentially harmful misinformation. And so what we would do is go in every day and look at what the top trending topics were, how people were reacting to national media coverage, what was being said, what was being shared, to then help the hospitals come up with appropriate communication plans to either correct misinformation or fill in maybe where some gaps were, where maybe the national media coverage maybe missed a point or two that was really critical and important to share out. And then kind of on a more micro level outside of the national narrative that these learning hospitals participate in was looking regionally at how the outbreak was spreading in the neighborhoods around the hospital, how neighboring or adjacent hospitals were talking about different concerns, right? And so within this, a specific example really was with PPE. The one hospital that we were partnering with felt like they had a pretty decent supply of protective equipment, but other neighboring hospitals started noting shortages. And so not only were we seeing neighboring hospitals talk about shortages, but the local community was reaching out, trying to ask how they could help, how they could either donate supplies that they had, or actually sew protective face masks, either for staff or the communities. And so in all of this confusion, there was like no real guidance on how to appropriately make a mask, or where to even drop off or provide donations. So we worked with our partner to actually develop easily socially shareable content to go through the process of how to effectively make a face mask, what that process looks like, how to do it easily and effectively, and maybe get other local workers that might have similar skills to sew or create something that might be out of work due to the pandemic, to help engage them, and then coordinate drop-offs of donations with the hospital to help distribute PPE and face masks.
Excellent. It's really interesting. Social media definitely tells us what our neighbors are doing. In this case, it told some hospital systems what was going on with their neighbors, that gave them information to show them how they could perhaps have the community help as well, and get what they needed to support the patients. So thank you for that. Maybe let's take a turn a bit, Chris, to private sector. Share with us some of the things you saw as the pandemic hit, into how companies were reacting to the changes.
Yeah, for sure. I'll definitely talk about commercial, and then just to piggyback on public sector and how that even kind of crosses over. I think what Mike was hitting on is great around really this connecting people to resources, like identifying a trend and saying, let's connect you to the answer you need or to the resource you need, was huge for public sector. People were relying, and still are, on public sector agencies in an unprecedented level and way, and in a way that keeps changing. So a lot of what was stood up that we were working on together was, let's cast the right net of flexible information collection, because as we covered earlier, and Kevin was mentioning early on, it was great for epidemiologists to say, where are people typing in cough and sneeze and different symptoms in Google, and actually trace hotspots. But then very quickly, we got a better beat on that, and it became a whole different approach to, well, what about disinformation and misinformation? So we had trends come up like, it's a lifetime ago, but people remember we never had guidance that said a mask is even the right thing because they were trying to preserve PPE. And that was from the CDC. And then it changed to be, okay, it's okay to have a mask. It's actually the recommendation. We had questions come up when we were supporting a major state on reports like this of things like, do air conditioners spread the virus? And is that going to affect me in my return to the economy when I am able to 25%, 50% go out someplace? Is insurance a requirement for free testing? So the pace of those changes was insanely fast. And so we needed technology like the social media listening tools, like tools that could watch Google Trends and what you're typing into Google, which is a different intent than what you tweet. And then also another intent of on-site surveys to collect information of, did you get what you need? Yesterday's questions become tomorrow's answers. And then all of that's backed up by good queries that cast the right search to say, let's tag a governor's name. Let's tag certain state agencies. Let's make sure that we're listening for the right things. And let's make sure that we group, theme, and classify those things very well. And that's been backed up by a lot of these technologies of artificial intelligence, natural language processing, so that human and machine can work together well. We still have to keep pace with it and figure out, what does that even mean? What's the why and the what next? Like Mike hit on of a good social campaign off of that, or a better website update to give you the content you need. But that was a common theme that we saw in public sector. I would say how that translates to private sector was really one and the same in a lot of ways. That newsroom mentality that we were saying of constantly getting the right insights and translating it to updated content and updated connection to the right resource was pretty pervasive in a few different ways. So I'll hit on kind of commerce and retail, a little bit on travel, and then a little bit on even the health space and what we're seeing with payers. So one thing that we saw with a client that we're working on in retail, they're one of the world's largest apparel brands. They're sold in stores all over the globe. We've already been working with them in a capacity to help work on their digital shelf. So if you think about, you go to a grocery store, someone's working on the end cap who works for Coca-Cola, not the grocery store, to make sure it looks nice and go buy Coca-Cola. The same premise is online, where companies who are more invested in digital are trying to own the digital shelf more. You only have so much control in Amazon. You only have so much control in these marketplaces where more sales are happening, and retail's having a hard time. So the more that you can help own that experience and lift it up and invest in it, you're going to do better when you don't just sell directly to consumers. Well, all of a sudden the pandemic hits. This company had a loss of like 60% of revenue for Q2, and they had to try to figure out, how can we bounce back from that? And they were seeing a huge surge, 200% plus, on their direct website and direct channel, which a lot of people are seeing broadly in commerce. And at least they were more ready for that. It's this shifting story. Certain industries are doing better than others. Certain channels are doing better than others. And they were at least ready because they'd made the investment both in their direct sales and in the online sales, the digital shelf of their global partners, hundreds of global partners, to better sell through that experience. And they're primed, and they're seeing a good bounce back of that kind of initiative of all their sales globally. But the hard part there is most people haven't invested properly in the digital transformation. And so this company, even with some layoffs, said, we're doubling down in this digital and then where we can influence direct. And other companies are trying to catch up of, if they haven't invested enough in the data, the analytics, the stitching it together for a 360 of what to do, and breaking down their own silos of how to work together. That's kind of a rude awakening at this moment to try to keep pace. On hotels and travel, I'll briefly touch there that we were looking at companies that are trying to get, that are traditional hotel players. How do they take data and enrich it and properly get at the Airbnb and the VRBO market, where a lot of us are now spending our time because it feels more safe? There's a huge surge in demand for that. And they were taking data that's available, third party with their first party, and saying, let's take all the metadata of our properties that we have, which ones have a pool that's desirable right now, which ones have this, and make sure that if it's geographically close enough to where there's demand from our current members who are loyal to us and new ones we can acquire, we can go ahead and say our hypothesis is that in 2-hour drive, you're willing to probably rent something like that because we're seeing a surge in demand. So again, it's that shift of how can we be quick to change the marketing mix, the messaging, and the experience side of it. And then as far as what we've just seen in self-service across all industries, but particularly with airlines getting their initial surge, was making sure that we could better give self-service options and new features for people to take care of themselves. I think we've all been a part of a 3-hour wait on a phone or seen a banner that says, sorry, unprecedented volume due to COVID. And it's just, again, really made this digital experience of not just the cost to serve, but a better customer experience to offer easier self-service options online and make sure that, chat experiences, frequently asked questions, and other self-service activities that need to be brought online fast are essential. And then finally, one more, and I'll pause there, is on health. Medicare sales, one of our client is going through that right now, Medicare Advantage plans, there's open enrollment going on. And as you can imagine, the grandparent segment that's looking after this is used to going to a seminar with donuts in person and getting educated about the experience. And obviously the COVID shift is placing a lot of pressure, again, on direct and digital. Can I do an online seminar just like this to educate you? But there's a technology curve where you've got to get those people comfortable and to adopt that. And so we're just seeing all of these shifts place more importance on digital and more importance on the data to analyze it, so you have agility to keep pivoting your sales force, your marketing, and all these experiences midway through.
Great. Thank you, Chris. Just real quick for the audience, please share your questions with us through the Hopin app. Questions or other topics that you want us, we will take a look at those and try to address those as we go forward in the session. Mike, could I ask you, when we think about social listening and digital analytics, could you break down a little bit more around the process and kind of the methodology involved in taking all of those tweets and mentions and Facebook posts and turning it into usable information and insights for our clients?
Yeah, of course. Yeah. So, we have this unique challenge when we're looking at social media data, in that we're dealing with both structured and unstructured data. We have a lot of information at our fingertips, but we have to segment, categorize, filter all of that information so that we can come back with one, usable insights, but two, we can also track those different clusters of information and see how they move over time. So anytime we set out to do something, I'll use COVID and higher education as an example here. We have to start with building out a listening framework, right? And so that's giving some structure to this. For higher education, what we had to do was sit and think about all the different things that could be impacted by COVID, and think about some high-level buckets. So, right, we would think about things like how is health and safety on campus impacted? How is the learning experience going to change? What will student life look like? Or even how are universities going to handle their administration practices? And so after we define a lot of these, broad stroke categories that are going to be impacted, we then start creating a lot of subcategories to this. So for something like health and safety, we think about things like, all right, what's COVID going to have in terms of an impact on mental health on students, right? So are we going to see an increase in signals and social posts from students talking about stress and anxiety? What kinds of support are universities offering to help mitigate these risks and challenges, right? So are we going to see an increase in conversations about more counselors or more free resources, or even virtual resources for some of these traditionally in-person services that the universities offer? And then, do students feel like this is enough? In this thread and thought process just continues on and on for each of these, right? And so as we start to build out each of these categories and thoughts, we start to think about how people talk about it, so that we can then develop and create keyword clusters, right? So this is now how we take these tools to filter through all of the data and pull back matches on keywords. and organize it into all these categories and buckets, right? And so the process usually takes about 2 or 3 days for a project like this. So we've built out all these hypotheses, and now we have a team of analysts that are actually manually going in there, looking at the results that are coming back, doing random samples of the data, looking for some noise that's coming in that maybe isn't helpful, that we can then create exclusionary terms to pull that out so it doesn't muddy the data coming in. And then along with that sampling, they're also hand scoring to see what those exact specific trends are underneath those categories. So now we're going to have metrics that we can track over time. We can track sentiment and perceptions along with that. But then also we have the manual context of what is it that's really being said under these topics? What are the big challenges? Are there areas of opportunity that these colleges and universities can address in either their official communications, or building out additional resources for students to help address things like if there was a surge in mental health concerns year over year, and it was about an 80% increase, which is pretty significant. And so that would then signal and tell colleges and universities that they need to invest a little more resources to address that challenge that their student body is experiencing. And so we have examples of things like that kind of across all these different topics, and we can figure that out from what's being said. So we kind of treat the internet like a focus group when we use these social listening tools.
Excellent. Thank you. And I know you were able to separate information coming from parents versus students versus faculty to really hone in to that specific group that we want to address, to understand their sentiments, how they're feeling, what misinformation may be out there that we can correct. Right. So yeah, excellent. Thank you. Back to you, Kevin. Thinking about government, I know you shared a story about some misinformation that got out there with relation to, earlier you talked about PPP, but maybe another government program that had some misinformation. Would you share a little more on that?
Sure. So we were running a large social listening program for one of the Midwest states when really lockdown first started and they went into quarantine. And during that time was also obviously a surge in unemployment. And one of the things that we found through social listening was a lot of confusion around not how to get unemployment, but confusion around what are the impacts of unemployment insurance, and what do people need to think about? Because one of the things that's really unique to our current point in time is there's a lot of individuals that are going to their state, their local, and their federal government for services whom have never done anything more with the government than pay taxes and get a driver's license. So they're not familiar with working with governments. They're not familiar with entitlement programs. They're not familiar with all the rules and regulations and things that may go with it. And one of the things that we found initially with through social listening was that people were really not familiar with how unemployment payments impact their taxes. And is it a taxable income or not? So one of the things that we were able to do is once we identified that there was a little bit of confusion, we actually launched a survey and we did some research. And we found in that research that nationally, only 2/3 of the individuals that are on unemployment realize that it would be taxable income. So if you think about that, 1/3 of the population has no idea that this payment they're receiving, and in some states, this payment is $1,000 or more a month. So it's a significant payment. They didn't realize that this was taxable income. So that's 1/3 of the population. Then we layered on that and we said, okay, of these remaining 2/3, who's actually doing something about it? And we found that only 1/3 of the population was actually doing something about withholding payments for unemployment, for tax from their unemployment payments. So, in theory, sure, your income's down, it's lower than it's been previously. It may or may not have a significant tax impact, but we dug a little bit deeper. So once we realized that this was a problem, then we dug in and said, how is this actually going to start to impact people in the state? So as we started to really look into it, what we found is that of this group of people that were not withholding taxes, when we looked at their spending patterns previously around their tax refunds, we found that this money went to do one of two things. It either went to pay for debt incurred during the holiday season, cover ongoing living expenses, or in other cases, it went to pay for medical services. So we realized that, this is a group of people that are not planning for taxes, that use this tax refund that they're used to getting for very important things to support themselves and their families. And we needed to get more proactive. So what we're able to do is work with multiple states to create some programs, leveraging both paid and earned media to make the citizens aware that, hey, the unemployment compensation that you're receiving is in fact taxable income. If you make $100,000 a year previously, you're at a 24% tax rate, sometimes a little bit higher. This is going to be taxed at that same rate, because 6 to 8 weeks of unemployment is probably not going to drop you into a new tax bracket. So be prepared for it. Start thinking about it, because nobody needs surprises when we get into tax seasons of next year, especially as we're looking at states trying to recover from an economic downturn. They need disposable income in the hands of the citizens in order to spend. And the way we've been providing this information was really short-term gain, getting dollars in people's hands, but not making them aware of how it's going to impact them long-term.
Right. So staying on the topic of unemployment insurance for a while, being able to get that information to the public that maybe had never been on unemployment before, because we had such an increase in job loss. There were so many more Americans that were getting unemployment insurance benefits. Having that information was really important. It's very important to have that information. What else can you share about looking at several states, how they reacted, and how states had to react in communicating with their citizens that changed really from the call centers and the increasing call centers and then to some digital methods? What can you share on that?
So with unemployment, it was a really just a matter of what states are most prepared for surge volumes. I think the writing was on the wall. All the states realized that, hey, you know what? We are going to get an uptick in unemployment as layoffs start to happen, initially with the service industry, and it just continued to spiral from there. But what we found very quickly is a lot of states didn't have the technology infrastructure in place to handle high volumes of unemployment applications at scale when it started to hit. So they also didn't have the luxury of having their unemployment offices open. Where they did have them open, where people could go in, they had to limit the number of people because they were social distancing, they were controlling the lines, controlling the flow. So it was a very tight funnel that was immediately created in just about every state in the country. And a lot of that was created because states weren't ready for this surge volume. They didn't do the digital transformation work up front in order to handle it. So there was really a strategy that we followed across multiple states. The first was triage the problem, get people into call centers, handle the volume, activate new phone lines, use some of the technology that's out there in order to very quickly spin up new virtual call centers that can start to deflect the volume into workers that can start to work with these individuals to get them on the benefits that they need. So that was step one. So once we then had that in place, then it was, how do we make that experience better? And really, what we were able to do is work with states and do a couple of different things. One was, you stand up the call center, you start to handle the volume. Next, you put in place some type of lightweight gating process through automated services to pre-schedule calls, schedule return calls at a certain time to take volume off of the call center workers, set it up so people aren't sitting on the phone waiting all day in order to do that. And then third is to very quickly start to implement new services to offload the volume of applications that were overwhelming the legacy digital platforms onto new modern technology that checks all the security boxes, but it's able to collect the information, funnel it through, and then get it into a processing queue within the back office of the departments of labor in order to move things forward. And that's the trend that we've seen, up to this point. And we've seen across multiple states that, an improvement in the overall process as they've started to evolve and learn. So the next step in this evolution now is, how do you take this concept of an unemployment application now and start to activate other services outside of just pure unemployment in order to help the individual drive better outcomes and ultimately improve the rate in which the state's able to recover, economically from the challenges.
Mm-hmm. Great. Thank you. We've got a couple of audience questions now. If I could address this first to Chris, and then Mike, if you have anything to add to it. What are some pointers that you might give to a company who's trying to track and read their own digital data? Where would they start? What would be a good starting place for perhaps a startup or a company that's trying to track their own digital data?
Yeah, it's a good question. I think so easily we even see the big companies that you would hope have more going on there don't under the hood, or it's got cobwebs on it. That's both on their website, that's on their app analytics, you name it. And so I think the pointers I would say is, a lot of companies get in this trap of, even when they have some of that stuff turned on, some analyst is just running some report over and over again and wasting their time as like a data monkey versus like, what does it actually say? What does it actually mean? How do you interpret something off of that for an insight to drive action? Because otherwise it's not helpful. And we've even had people to turn off all their reports before and say, which ones even get requested? A lot of them don't get requested, and you find out I can repurpose that person for actually the things that they should be doing at the beginning of the process, which means we have to ask the questions we want answered up front. And so the basic good practice there just functionally would be, create a framework of what are the most important KPIs for your business. So if you're a lean startup, you have certain hypotheses you want to test in the market, you have certain objectives you want to hit. Well, let's go figure that out. We did that early as a startup for ourselves about what was our sales funnel, how good was that, making sure we tracked actual data and had inputs to it. As far as making sure you have a good framework for it, set baselines. So make sure that you collect a baseline of the data that are those key metrics. And it sounds simplistic, but make sure it's as measurable as possible for the key things, set the baseline, and then set a target of where you want to go. Then that can infuse into all of your operations of what you're trying to do to drive that metric to the place you want. And then I would just say, start with the basic, if it's free stuff, if you're a startup, Google Free Edition's not bad. It samples data for your web analytics, but it's pretty good. There's similar tools on your app stack. So just start with that. And out of the box, it's at least going to give you some basics on your paid media marketing mix by channel. It's going to give you some basic things. And with literally very lightweight analyst or developer setup, you can at least instrument your 3-5 magic metrics to have a couple conversions be tracked. So at least the key moments that most matter, you can better understand and do the baselining we talked about and start to track and trend over time. And that keeps it simple to understand to that part of the question, just because you now have your best scorecard for your business laid out. And you can then mature down the line to say, how do we get this to be more robust? How do we get all the micro interactions and metrics that correlate to these things? And that's more fancy down the line, but this is an easy place to start. And anyone, even on the business side, can wrap their head around understanding some of that data and the trends.
Yeah, and I'd echo that as well in terms of, trying, not getting, mired in all the minutia of data. You can go out and collect everything for sure. But the amount of data that's actually going to be helpful for you are going to be the ones that are going to answer specific questions that you outline first, before you go diving in. And so, what I tend to try and do is take, large sets of data, put them into buckets that maybe a lot of data points might ladder up to something like awareness might be something that I'm tracking in the digital space. And so I can watch how awareness moves. And then if it, shifts, 1 or 2 standard deviations away from that mean baseline that I had, I now know that something big happened, and now I can take the deep dive. Otherwise, you can spend all day just combing through data.
Excellent. I also think about the employee experience and all of the stuff that folks are posting about the companies they work for and how we're all managing during the pandemic, and the things that companies are doing for their employees to help us as we're navigating this new world that we're living in, with support for childcare, working from home, or new equipment, or flexible hours for some folks, or those kinds of things. And I think about the things that we're seeing about our neighbors' workplaces. We have a lot more visibility into that than before. So perhaps the idea of the employee experience and how companies are treating and supporting their employees during this will be something that can help those companies in the war on talent when there is a lot more job openings that get resumed. What other comments do you guys have on the employee experience as it relates to social and data? This can really be for anybody.
So the employee experience?
Uh-huh.
Yeah, well, I think just in general, from a very high level, the landscape is shifting so quickly right now, not only in terms of how much data we can gather and the sources that we can gather it from, but also various levels of legislation being passed along the lines of what we can and cannot collect and how we can use that data. In previous years, the biggest challenge from the employee perspective was really just trying to figure out where all the key data points sat and how to integrate them and how to use them. And now it's this extra layer of navigating shifting legislation.
Yeah.
So it's definitely, keeping on top of news trends and then having to socialize that out broadly throughout the organization.
Great. Let me try to get to a few more of these questions. Biggest misconceptions about data right now. Mike, let me see if you can share your thoughts on some misconceptions about data.
So that ties in nicely to kind of where I left off there, right? So some of the biggest misconceptions actually are along the lines of data privacy, kind of big brother, especially when you look at things like social listening, right? So a lot of the questions that I get are kind of like along the lines of, can you see everything that I'm doing online? Is this an invasion of my privacy? Really when it comes down to it, is there is so much data, again, that when we're looking at our systems, everyone's an anonymized number. We don't know that tweet that then was followed by a certain action was specifically Melissa doing this, but there's this group of people that behave this certain way, and we can analyze these behaviors at a macro level and kind of give a larger definition and attribution to that group, and then we can target against a large group rather than a specific individual. So it feels like it's one-to-one and that we're really understanding everything you do, but we're just understanding a group of people like you.
We have information in aggregate to really identify what you are individually are thinking. Excellent. Let me try to get to one more of these questions. Back to government. Kevin, let me have you take this one. How do we move forward and make sure that people have information on some of these government programs so that the information is easy to access and easy to understand, knowing that citizens are going to access these programs as we go through the pandemic?
Sure. So it's actually a great question. When we started our social listening program for government, it was really to address that specific question. The reality is, we talk about the bureaucrat in government, and our governments are full of brilliant people. They understand their domain. They're in it for a reason and they're in it for cause, but they're also so deep into the program that they're not able to truly convey the information well. They're writing in a very technical way. And then in most states, they're publishing that content up and they're the owners of it. And what we found is we need to do significant work with the information officers within our various agencies to ensure that they're training their people to write for the web. They're training people to understand the relevancy of content, to understand their audiences. They need to focus on, truly building out the personas, but more importantly, building out the mindsets of the individuals that they're trying to connect with. Understand the motivations that they have, and then tailor the information. Systems also need to be modernized in order to personalize that information and that content so that we are getting the information to the right people in the right channel in which it's relevant for them. So there's an awful lot of work to do in our state and local governments to convey data, but it's really comes down to governments are full of brilliant people. We need to be able to create systems and tools and processes that they can use in order to convey the information to the public that they want to get out there.
Yep, in a way they can understand. Great. Let me thank you very much. Let me thank my colleagues at Accenture, Chris Armstrong, Kevin Ellenwood, and Mike Sneed. Thank you so much for this conversation. And I'll hand it back to Meg for the next session.
Perfect. Thank you, Melissa. And real quick, I did have to switch over to my headset. So can you guys hear me? Just making sure I had. Okay, great. Awesome. Thank you so much. So thanks again to Chris, Mike, Kevin, and Melissa. I loved hearing that conversation. Kevin, you know, one of the things you particularly said was around governments looking at the value of data, particularly what are citizens saying? Can we identify hotspots? Finding the real value of social for governments and understanding what people are not getting. That was really, really meaningful to me. Also, the fact that governments are full of brilliant people. And we need to design systems that enable them to convey their information to the public. You know, Chris, you talked about how private sector companies are responding, identifying trends, connecting people to resources, offering a better customer experience, placing more importance on digital. Mike, you talked about usable information, looking for unhelpful noise, looking at the trends, looking at the metrics, looking at sentiment, and really honing in on misinformation. So thank you for that great panel again. All right, so we are heading into our final session of the COVID-19 Innovation Track. Thanks again to Accenture for sponsoring this track, and thank you to the Capital Factory and Austin Startup Week for giving us this really great opportunity.